Hi, I'm Sarah Suddick. I'm ward manager of the elective surgical ward that looks after bariatric patients post-operatively. So when you arrive on the ward, the nurse and staff will check all of your observations, your pulse, blood pressure, temperature. They'll make sure you're attached to a drip, which will stay up overnight to keep you hydrated. They'll make sure you're aware of how to use the nurse call system. And they'll also help you contact any family members if that's necessary. They'll also check all your wounds and make sure there's no bleeding and that your dressings are clean and dry and all nice and intact. So all being well, you'll get home the following day after surgery, usually on the afternoon. Doctors will review you on the morning on the ward rounds, and then if they're happy with your blood results, you'll be allowed to start eating a period diet. If that's tolerated and your pain's well controlled and you feel well and your observations are okay, then you'll be allowed home. So when you arrive on the ward, you will have floatron machines attached to your legs, little machines that act as a compression, and they'll just stay on overnight. They'll be removed in the morning when you get up and mobilised around the ward. You'll also receive an injection every day. The nurse and staff will show you how to administer this, and they'll also give you an information leaflet that gives you a step-by-step guide. If you're unhappy and think you can't manage that, we can arrange for a district nurse to come out and help you with those injections, or you can attend a practice nurse who will also help with the injections. Your wounds will be checked when you first come back from theatre. They'll also be checked a couple of times overnight just to make sure there's no problems. The following day, your dressings will be removed and the wounds will be checked. You'll be given advice on how to look after your wounds at home and a supply of dressings. You'll also be given a leaflet that will provide step-by-step guide on how to change your dressings if needed, and will also provide details for the wound care hub or practice nurse details for you to attend. So what we normally say is that you should refrain from driving until you can do an emergency stop. Obviously, everybody's different. Some people will be able to drive a little bit quicker than others. We also advise you to please let your insurance company know that you've been in hospital and had surgery. We give them wound care advice. We make sure they've got dietitian advice to follow. We also make sure that the pharmacist is giving them advice and clear instructions. We make sure they're aware of wearing their TED stockings for up to 4 weeks post-operatively. We also advise them to make sure they keep mobile, hydrated, and to contact the ward if they've got any problems. Obviously, you can always contact the ward and contact number will be given. But during Monday to Friday working hours, we would suggest that you contact the bariatric specialist nurses or the dietitian regarding on what type of problem or advice you would need. If it's out of hours or on a weekend, then you can always contact the ward or attend accident and emergency. But obviously the nurse and staff on the ward are always there to give advice as well.
So hiya, my name is Lucy Thompson and I'm a dietetic assistant practitioner here at Sunderland Hospital. So as part of the Tier 3 pathway that Lisa, the bariatric specialist nurse, spoke about, you'll be invited to our sessions. You can choose to do these either online or you can come and see us in person. Our groups are hosted by experienced diet support workers and are a welcoming environment. Surgery can help us to change, but there are also changes to food that can help the surgery to work well for us. So we'll encourage any changes that will be helpful to you and support you through the process. So groups are great for connecting people with similar experiences, and everyone in our groups are also on the surgery pathway. There's a lot of evidence that being in a group where we can share advice and come up with solutions can really help us to feel more supported and more motivated. We do also get a lot of comments about how nice it is to speak with other people who understand, and actually some surprise at how many other people are also interested in the surgery. We aim to support in ways that are suitable for everyone, so if there are any adjustments that would help you in our groups, or you feel that being in a group may be difficult, please let us know and we'll look at how to support you. After attending our sessions, you will also have a one-to-one appointment with one of our specialist dietitians to cover anything you may need more personalised advice on. So the sessions are to share information on food, health and diet for surgery. We can help you adapt to new eating habits where needed. But we also think about how food can help certain health conditions and our overall well-being in general. So for example, we'll talk about where to get nutrients we need from food, how the environment around us can affect habits, and how changing our thoughts around food may be helpful. We will also reassure you about the bits that are already going well for you, so you can leave feeling confident about what you're doing. This is information about food that you can trust as factual, and there definitely won't be a lecture on diet. We're here to support you.
So my name is Ness, I'm one of the lead senior dietitians, and our team is made up of dietitians and support workers who patients are likely to see regularly for support while they're under the care of the bariatric service. Patients will first meet us after they've been to the group sessions with the support workers, where we get the chance to get to know them and understand how we can best support them, offering personalised advice in the lead up to their surgery. Part of our role is to help prepare patients with the changes that are required, but also help them after surgery, supporting them typically for about 2 years. We are a friendly and non-judgmental team, and we do hope that people feel that they can ask us any questions that they need to. So the liver reducing diet is a diet that is recommended in the days leading up to the surgery. It's designed to make the liver smaller and more flexible. So because the liver sits on top of the stomach, which is where the surgeon will need to operate, it is less likely to be damaged and therefore makes the operation safer. Here at South Tyneside and Sunderland Foundation Trust, there are 3 different versions. And this depends on if you've got diabetes and if you take insulin for this. They're all sort of low in energy, especially low in carbohydrates and fats. And while there are differences in the amount of carbohydrates, the diet's mainly based on milk, yoghurt and some fruit. In the weeks after surgery, not only is it important to restrict how much we eat, so we're talking about spoonfuls of food, it's also important to change the consistency, so the texture of food. And this will allow the body to heal and recover. Therefore, we gradually need to build from fluids back to solid foods over about 6 to 8 weeks. If solid foods get introduced too quickly, this can cause a leak in the digestive system, which can be extremely dangerous. Over that 6 to 8 week period, portion sizes can increase. And once solid foods can be managed, it's important to get a range of textures and a range of foods in the diet. So it's not about seeing yourself as being on a diet. Rather, it's about making healthier choices more often to try and achieve a more balanced diet overall. It is recommended that portion sizes are kept small long term. So some people find it useful to serve their dinner on a side plate rather than a dinner plate. And a range of foods is going to give our body that range of nutrients that it needs. And it's also important to get enough protein for our body, so keeping muscles is important. There might be some foods that people can't manage long term, but we're here to help people and guide people to find alternatives that can be managed so that they can still achieve that healthy, balanced diet. There might be some parts of life that involve eating that look different after surgery, eating out of the home, for example, or ordering takeaways, even types of holidays that you go on. But again, we can support with this, and we really help people to connect with others who've had the surgery, because sharing ideas with those people, on how to adapt is really good. Due to the nature of the surgery, we can't just rely on having a healthy, balanced diet, and we can't just rely on having the nutritional supplements. It is recommended to do both. And this will reduce the risk of any problems happening when our body isn't getting enough of these vitamins and minerals. Every day, for the rest of their lives, patients will be recommended to take various supplements. And this includes a general A to Z vitamin and mineral. And they will be given a list of suitable ones to be taken, which can be bought from various high street shops, supermarkets, and online. GPs will also prescribe calcium, vitamin D, folic acid and iron, and these are to be taken every day, and vitamin B12 injections that will be given every 3 months. It is advised to take these supplements lifelong. Blood tests will be taken regularly, and extra supplements may be added in if these are needed. So this is something to consider if one of the reasons for you having surgery is to try and take less pills. Not only after surgery is what we eat is important, the way in which we eat is also important. So we recommend patients to eat slowly, chew their food well, stop as soon as they feel full, but also keep food and fluid separate. And this will help people to avoid some of those common problems after surgery, such as pain, nausea, vomiting, and dumping syndrome. Some people do lose a lot of hair and muscle mass, and this tends to happen in the first 6 months, where weight loss can be very quick. And we know that muscles are important not only for strength and movement, but also for keeping down the amount of fat we carry. Yes, alcohol can still be enjoyed as part of a healthy, balanced diet after surgery. The government recommends us to have a maximum of 14 units per week, but to have rest days where we don't have any alcohol at all on these days. Something to note though, after bariatric surgery is that alcohol can be absorbed much quicker, so people often feel the effects much quicker too. If someone does choose to drink alcohol after their surgery, it is advised to keep it in moderation, as an excess of alcohol can cause serious health problems. The aim of bariatric surgery is to improve somebody's health, not for cosmetic reasons. Those patients who are perhaps disappointed with their results after surgery often has set themselves quite specific and quite often unrealistic weight loss targets. So instead of weight being the only measure of somebody's success or progress, we would encourage questions like, have they had an improvement in their mood or pain? Are they able to do daily tasks easier? Do they have better relationships with others? Are they sleeping better? Perhaps they can look after themselves or family members better. Are their medications reduced? Do they have a healthier diet and therefore have improved their health? But ultimately, by improving health, we are reducing the chance of long-term disease. If someone's planning a pregnancy, it is recommended to wait 18 months after the surgery. This is because you're more likely to have problems in this time. After the surgery, it's more difficult to give the growing baby the nutrients it needs for normal growth and development. So we do recommend to take extra precautions. If someone's on oral contraception, they might need to get these reviewed with their GP. If someone does become pregnant after bariatric surgery, additional supplements are recommended, so we would encourage them to get in contact with the team for extra support. Well, physical activity is fantastic for overall health. We know it reduces blood pressure, reduces cholesterol, and helps improve mood and mental well-being. We do know that physical activity can help with healthy weight loss and can improve muscle tone and tones loose skin. It is recommended that we aim for 150 minutes, that's 2.5 hours of moderate intensity activity each week. If you struggle to make time, try to incorporate it into your everyday. So this could be taking the stairs instead of the lift, for example. It could be getting off the bus a stop early and walking the rest of the way, or parking your car a little bit further away. It is not advised to lift heavy weights in the 6 to 8 weeks following your surgery, and the team will advise you on when it's appropriate to do certain exercises. There are 2 types of dumping syndrome, early and late. Early dumping syndrome tends to happen in the first few months, And this is where a valve at the bottom of the stomach is either bypassed or isn't working well. And largely undigested food is dumped into the small bowel, which can cause it to stretch. This itself will cause pain, cramps, watery diarrhoea. You might even be sick, feel bloated, feel faint or dizzy. And these symptoms tend to happen up to about an hour after eating. Late dumping can develop after around 18 months after the operation. And this is a condition where the body makes too much of the hormone insulin after eating a meal that's high in carbohydrates that then leads to low sugar levels. Symptoms can tend to happen around 1 to 3 hours after eating. Tends to include similar symptoms as early dumping syndrome, as well as more serious ones such as fainting or passing out, loss of concentration or mental confusion even, and a rapid heartbeat. But for both early dumping syndrome and late dumping syndrome, again, the dietitians can advise changes to the diet to help with this.
Surgery is a powerful tool for weight loss, but it changes your body and not your brain. Our job in psychology is to help you understand your relationship with food and to help prepare you for the emotional and lifestyle changes that come with surgery. Our goal is to support you in making these long-term changes so that you can live well and maintain these changes after bariatric surgery. For surgery to work, it is more than just the operation. It is about making long-term lifestyle changes, and psychology can help you to look at what might get in the way of those changes. For example, many of us can turn to food in response to emotions like comfort, stress, or boredom, something that we have learned over time to help us cope in difficult situations. Learning other ways to manage our emotions is an important part of making surgery a success. The everyday stresses and challenges that make healthy choices difficult now, for example juggling our work and family demands, will also still be there after surgery. Psychology helps you to understand what gets in the way of making changes and helps you to plan and build skills to manage difficult situations, thoughts and emotions. Surgery is a life-changing procedure, so it's important to understand how it might impact your life and how you can maintain the changes needed to make it work. The work you put in before surgery will help you maintain your progress afterwards. There is often a honeymoon period just after surgery when weight loss feels easier, but once that settles, it's your mindset and lifestyle habits that make the biggest difference for managing your weight in the long term.
When you are referred, we will contact your GP to get some information about your mental health history. Many of our patients who go on to have surgery have accessed mental health support in the past, and having that background information helps us understand what support you've already had and what support might be useful going forward. Most people will be invited to attend one of our psychology groups. These sessions focus on the emotional and psychological side of surgery, things like how surgery might affect your social life, body image and confidence, as well as information on making positive changes, like eating regular meals and reducing turning to food for comfort. We know that people often find talking to others in a group difficult, but many people tell us after the groups that they find it really helpful to hear from others who are going through a similar journey and get a lot from the experience. We offer groups either by video or face-to-face, so if you have a preference, please let us know. After the group, all patients have a one-to-one appointment with a member of the psychology team. This is a chance to talk about your individual goals, what is going well, and what might still feel more challenging for you. Together, we will create a plan that feels personal to you and your needs. It is worth mentioning at this point that there are national guidelines around surgery for us to follow that help make sure it is the right time for you to go ahead with surgery. For some people, surgery may not be the best option just yet. We know this can be very disappointing, and we do our best to guide and support people to look at their next steps. When this happens, people will spend some time working on these steps, sometimes with support from other NHS services, and then come back to us when the time is right.
Yes, we continue to offer support for up to 2 years after your surgery date. During that time, we can help with things like adjusting to your new lifestyle, maintaining your motivation, managing body image concerns or changes, and coping with the unexpected emotional ups and downs. The main message we want to get across is that you are not on your own. Surgery is one part of your journey, but your mindset, your habits, and your emotional well-being play a huge part in your long-term success. We are here to support you when it is needed, both before and after surgery. There is no shame in needing support. Our aim is to understand and help you to live the best life after surgery.
I hope you found this seminar worth your time. You will undoubtedly have questions. It is useful to write them down and ask the healthcare staff at your appointments. You will see our nurses, our dietitians, psychologists or physicians if needed, and of course, surgeons. We want to help you achieve nothing but the most extraordinary results that will make significant improvement to your health. To that end, best wishes and goodbye. Thank you.
Hi, I'm Aaron, one of the bariatric specialist nurses. I hope you have found this seminar useful. If you wish to proceed and make your appointment with the specialist nurse, please call the number on the screen.
Here at South Tyneside and Sunderland NHS Foundation Trust, we are proud to be a research active organisation. Our bariatric team participates in a number of ongoing clinical trials designed to improve outcomes, enhance patient experience and shape the future of weight loss care. Current studies, including the MARS trial and the LightBar study, are helping us better understand the safest and most effective approaches to bariatric treatment. If you would like to find out more about any of our research projects, or are interested in taking part, please use the contact details shown on the screen. We are always happy to answer your questions and support you on your journey.